Welcome everybody to the Health Overview and Scrutiny panel. My name's Councillor Kieran Connolly and I'm the chair of this panel. Some housekeeping today. So the meeting is being live streamed on YouTube. A version will be available after, should you wish to watch it back. As a reminder, decisions that are made kind of in this virtual medium still have the same validity as if it was all of us back in the chamber, face to face. To avoid background noise, if people could put their microphones on mute, that'd be great. If you want to speak, we're going to use the hands up facility on Teams. Don't worry about the chat, I can see you all, so just use the hands up facility and then I'll call you and then you can speak at that point. If you need to leave during the meeting, I know a couple of you pre-warned me, do let us know so we can capture that for the minutes. And finally, when it comes to voting, we're going to do it in reverse order and on block. So i.e., are you going to abstain? Unmute yourself, say yes. Are you going to vote against? Say yes. If it's in a minority, that's obviously going to pass. I'm not going to ask officers to introduce themselves now. When you get to your item on the agenda, please do so then. But before we get started, I kind of just wanted to take a few moments to thank all of the councillors and officers who have kind of supported me over the last few weeks as I became chair. And I spoke to many of you individually as well, and you've offered great advice and things. And not to embarrass her too much, but I do particularly want to single out Ros Willis, Councillor Ros Willis, who you'll know was chair under the previous administration, who, although we're not the same party, she kindly gave me excellent advice. So I wanted to thank you for that. That's really appreciated. And just a final warning, we might need to swap the agenda around if some of them are taking a bit too long, because I'm mindful we've got a GP that needs to do one of the items on the agenda, and GP times are precious. So I'll let you know if that happens, but we'll try and keep to time as best we can. So on that, we'll now start. So the first item on the agenda is the election of a vice chair. So the way this is going to work is if somebody wants to nominate themselves or nominate a colleague to be vice chair, that would be appreciated. You would need to be proposed and seconded and we'd need to do a vote, but I'll worry about that in a moment. But is there anybody or their colleague who would like to nominate someone to be vice chair? Don't all come running at once. Right.
Can I make a nomination?
Of course you can.
I haven't spoken to the person, so this is going to come out at the blue. But being chairman under the previous administration, I wondered if Ros would want it, or if she's got too many things on her go.
Well, thank you for that, but I do have quite a lot on, and I'm all right to be there in the background, you know. But actually being vice chair, I would prefer not to because of everything else that I've got going on at the moment. But thank you anyway. But I am there if anyone wants to chat, as I have done before. So thank you, Sandra. I was wondering if Councillor Cherry would like to do it because of all her, you know, issues that she has with care homes, etc. And I wondered if Caroline would like to do it. I'd like to propose that, but I don't know if she would.
I should have probably done a roll call first. I've swapped the order out, didn't I? Councillor Cherry, you're in the meeting. Do you want to say if you're happy with that? Okay, I'll tell you what we're going to do. We're going to swap. We'll park this and we'll come back for it towards the end of the meeting. I think that's the best way forward on that one. So we'll move to public statements. We've got 4 that have come in. 3 of them relate to Graham Road and one's about something different. So these are going to be read out by officers. I think, Leo, are you reading out all 4 of them?
Yes, I'll read all 4, Chairman.
Thank you.
We've had 4 public statements. The first is from Dr. Agazis. I think that's the correct. Is that the correct pronunciation? Hopefully so. Her presentation reads as follows. The report outlines the business case for a central Western primary care facility. This is a misnomer. The surgery should be called the out-of-town medical surgery. Locating the surgery at the rugby club ensures that there will be no GP surgery within a mile of the town centre. The report acknowledges that many GP services were removed from the town and were located in 168 Locking Road. Yet on page 11, it refers to patients from Graham Road and Clarence Park as the only ones to be affected by the proposed relocation. Figure 4 on page 36 shows a distance of 30 metres between the existing and new sites, a 10-minute walk. Anyone who could make that in 10 minutes doesn't need a doctor. They should be going to the Tokyo Olympics this summer for high jump and sprint, enabling them to negotiate the railway line. I choose to believe that this is not an attempt to deceive, but rather a plan by those who have no sense of the geography of the town. And it makes the tables in Appendix A of the presentation incorrect and misleading. I've consulted widely: Western Hillside, Town Council, Civic Society, an ex-patient group. None of these feel this is a good site. Most objections centre around its inaccessibility to town centre residents on foot, bicycle or by public transport. It is predicated on car use, which goes against our climate emergency policy. Finally, looking at the reality of the planned development, the least awful scenario is that the proposed local development of shops and housing happens. How many years will the whole area be a building site? Diggers, dust, etc. Great for a health project! Exclamation mark. The worst scenario recognises that Weston has many vacant brownfield sites. This is because developers acquire land cheaply and are prepared to wait for years in the hope that prices will rise and make development viable. Should this happen, the new surgery will be left in the middle of nowhere, ironically named a town centre facility. You have the opportunity to look again constructively and creatively at a range of sites, to work with NSC to genuinely provide a medical facility that meets the needs of Central Western. The second public statement is from Brian Sheldrake. This reads, I am not aware of the powers of the committee, but I think it is appropriate that it should be recommended that the CCG should scrap the present proposal and reset the remit for a new surgery. 7 years ago, the two centre surgeries along the boulevard were moved a mile away along the busy Locking Road. Since then, the Stafford Place part-time surgery has closed, and during the period, the drop-in centre has opened and closed. During this time, we have been promised a replacement town centre surgery. In the last few years, it has also been apparent the Graham Road surgery needed improving or replacing. This latter requirement has now completely taken over, as I see that before you today is the Graham Road GP surgery relocation proposal. The needs of the very disadvantaged town centre is glossed over with vague mention that this will be addressed sometime. Another 7 years maybe. Calling the proposed site Western Central Health Centre is insulting to our intelligence. The needs of the north centre of Western is that the area from the boulevard up to the hill has not even appeared to have been considered. This is an area with many flats and older people. To my knowledge, it takes hours to attend the 168 surgery in Locking Road if one has to fit in two bus journeys each way, not to be recommended for young mums with pushchair or frail older people. Looking at the evaluation criteria, I see that the panel had members from Peer Health Group Limited, Serona Community Company, the NSC, and a very small number of members from Graham Road Surgery. Patient participation was very small and significantly did not include any from those whose surgeries were moved away 7 years ago. They always ignored the disadvantaged people in the town centre and have been ignored yet again. The main driver for the location seems to have been that it is a greenfield site with a developer already to welcome a proposed surgery that will increase the value of his estate. What has happened to all the plans to regenerate the town centre? The plans to increase residential accommodation, the plans to reduce traffic and pollution. It would have been an ideal opportunity to incorporate a GP surgery in these plans for the town centre. Regarding the evaluation criteria, Appendix A, it gives details regarding distance. For the replacement area considered, it still shows that nearly half will have over 20 minutes walk. That is if the times are right. Distance by path is less subjective. Getting to the proposed site in winter will be daunting for walkers with young children and older people. One wonders how many of the evaluation team have tried to do so and also have walked around the town centre. I repeat, the terms for replacing the town centre surgeries from 7 years ago up to the need for a Graham Road replacement have not been met. Forgetfulness surely cannot be the reason. Willful ignoring of the needs of all from and near the town centre seems more likely. Please take this last chance to remedy your mistake. The third public statement is from Alan Rice. This reads, "Thank you, Chairman and Councillors, for this opportunity to address HOS this afternoon. It's most refreshing, and it's an opportunity that was denied to 99.99% of Graham Road surgery patients of being given a choice on the site of the long-awaited new health centre. I've only lived in Weston and been a patient at Graham Road for just over 6 years, but I understand this new health centre has been mooted for about 30 years. It was on December 17, 2018 that our MP John Penrose welcomed the decision by Matt Hancock to give Weston over £3.2 million towards the new primary care services in Weston. The report before you today on the relocation of Graham Road surgery has been a long time coming. It was 2 years after Mr. Penrose welcomed those funds that patients learnt of the decision taken to site the new centre at Weston Rugby Club. For 2 years, 99.99% of Graham Road patients had been left in the dark. I say 99.99% because although the PowerPoint presentation on the Graham Road relocation proposal states the evaluation was conducted by representatives from Peer Health Group, patients, Sirona, North Somerset Council and the CCG, I am led to believe only 3 patients were involved in the final choice and they were sworn to secrecy. Incidentally, one of those patients, I believe, is in fact a patient of another surgery, not even in the Peer Health Super Partnership, which covers 93,000 patients across Weston. How were these patients' representatives chosen? The funding is indeed welcome, as is the new health centre, but testing the waters with actual Graham Road patients indicates the new site is not welcome. It is not on a bus route, detached from the town centre and on the wrong side of the railway tracks. The statistics show that less than 10% of patients who live within 5 minutes walking distance of Graham Road surgery will live within 5 minutes walking distance of the rugby site. But these are the most vulnerable patients. Graham Road surgery is in the centre of Weston Central Ward. The Central Ward Health Needs Assessment, issued in May 2016, states the Alfred Street and Grand Pier areas, both on the other side of the railway tracks from the rugby club, are amongst the 2% most deprived areas of England. At the other end of the scale, the statistics show over 50% of Graham Road patients currently live over 20 minutes away, which will be the same at the new rugby club site. But a large proportion of those will be originally Clarence Park surgery patients who were moved to Graham Road when Clarence Park closed in 2019. At the time, there was a patient's outcry from Clarence Park on the distance to walk to the new Graham Road surgery and the lack of a convenient bus route. In less than 2 years, those patients are told that distance will double. In recent years, Graham Road patients who moved outside the catchment area were told they could no longer remain on the surgeries list and would have to find a new surgery. This is still a hot topic on Facebook, with only this week a number of dissenting voices on this imposition and the lack of choice as promised by the NHS. I guess the reason is the expense of doctors making home visits. It makes me wonder whether these distant patients will be dropped when relocated to the rugby ground site. The report states a consultation will be held throughout the summer of 2021 with a final proposal to go to NHS England and the Department of Health and Social Care this winter. A consultation on what? The site has been chosen with no alternatives being offered. Perhaps it's on more important matters like the colour of wallpaper. There has been no meaningful consultation as far as Graham Road patients are concerned. They have been left in the dark. I ask HOSP to seriously consider whether the process so far is fit for purpose and meets the requirement to consult the actual patients. I am one of those patients and a former chair of Graham Road Surgery Patient Participation Group, EPG. Thank you. The fourth and final presentation is from Dr. Martin Hein. This reads, the successful management of the COVID epidemic requires that the prevalence of the virus is kept as low as possible. Vaccination alone will not do this. It's been accepted that an effective, locally focused test, trace and isolate system is essential for success. Good communication and openness with the population is absolutely essential. And that is the reason why I've promoted the following North Somerset constituency Labour Party motion. North Somerset CLP calls on the Labour group at North Somerset Council to campaign for the test and trace and isolate system in North Somerset to be well resourced, monitored and accountable to the people of North Somerset. It's vital that an effective system is in place for the long-term control of the epidemic. We call for the Labour Party group to obtain answers to the following questions as part of an ongoing campaign to control the epidemic. The questions read as follows. Will new money be coming from central government to finance the service? What extra personnel will be required and how will they be trained? What are the expected numbers of contacts and how will non-compliance be dealt with? How are local people who are isolated being supported? How is the system being monitored and how will the people of North Somerset find information about the service? How will North Somerset Council monitor infection rates in schools when pupils return, given that schools act as vectors of transmission? How will North Somerset Council make certain that it will not be held accountable for failures in the national service? That's the end of the statements, Councillor Cronley.
Thank you, Leo. So the three that relate to obviously Graham Road will pick up on the Graham Road item. The last one from Dr. Hein, I think, has probably ended up in the wrong forum, so I'll redirect that to my Labour colleagues, and we'll pick that up outside of that. Okay, so moving on to the next bit. So apologies for absences and any substitutions. So Leo, have we got any?
I've not received any apologies, Chairman.
Okay, and anyone from the floor? No hands are up. Okay, so what we're going to do is we're going to do a roll call to check who's here. Leo, I'm assuming it's you, but can you read out the name of the councillors, and if councillors could respond and say present, that'd be great. Thank you.
It will be my colleague Brent Cross, Chairman.
That's fine.
Thank you, Chairman. Let's start with the Chairman. Councillor Cronley.
Present.
Thank you. Councillor Applin.
Present, here.
Thank you. Councillor Cherry.
Present.
Councillor Cole.
Present.
Councillor Gregor. Thank you. Councillor Havison.
Present.
Councillor Hearn.
Present.
Thank you. Councillor Jacobs.
Present.
Thank you. Councillor James.
Present.
Thank you. Councillor Parker.
Present.
Thank you. Councillor Snaden. Thank you. Councillor Willis.
I'm here.
And Georgie Big.
Present.
Thank you. Thank you, Chairman. That's everyone.
Excellent, thank you. So any declarations of pecuniary interest from anybody? I see lots of head shaking, so now I'm nodding, so that's a no. Okay, so we move to minutes. So the last minutes were on the 8th of October 2020. That's a fair while now. Anyone got any points to raise about inaccuracies or anything like that? Nope, I can't see anything. Okay, so I'm going to suggest these just are adopted, but is anyone dead against that? I'm assuming not. No, in that case, I'm going to say they were fairly reflective and we'll approve those. So moving on to matters referred by council, exec or other committees, the short answer is there are none. So this brings us up to the first substantive item on the agenda, which is pandemic response in North Somerset, and that will be led by Matt Lenny, Director of Public Health.
Thank you, Chair. And if it's helpful, I'll share the slide deck that has been included with the papers, and then I'll talk to the issues within that. So this is meant to be a broad overview. I can work my way through those slides relatively quickly, but if councillors have questions, or I'm happy to take those as we go along or at the end of the presentation, whatever you prefer, Chair. But happy to do it either way. Can I just check to see if the slides are showing okay?
Yep, I can see them.
Great, thank you. So some of the data in this will be slightly out of date because obviously it was prepared a few days ago, but I can at least in principle talk about where we are in terms of any updates. But the broad brush is more or less the same in terms of key developments. So just moving on to the next slide, which shows the change in terms of the case rate across North Somerset, and you can see from November 2020 all the way through to March 21 the peaks and troughs in the numbers of cases we've had in North Somerset, and that's shown as a rate so that it's comparable with other local authority areas. And we've had a significant change since the beginning of this year, with the drop from over 400 per 100,000 rate of cases down to, so it's at 35 as reported on the 8th of March. It's risen slightly since then, so we've gone to just over 40 per 100,000. But I think that is probably to be expected at this point in the pandemic. And we're seeing that reflected in other local authorities. It's a slowing and a levelling off of the rate of reduction. And as we move into the situation where more parts of society unlock, and we've seen that most recently for schools, but we expect other parts of society to unlock over the next few weeks. We will still have some cases of, within our population, particularly amongst those unvaccinated individuals, and we will see closer contact between people as they move back into settings like schools or workplaces or more social settings. So we know that we won't be seeing the back of COVID. It's not a linear sort of progression all the way down to zero. It's about living with COVID and trying to work with our local communities to encourage people to continue with the protective behaviours and to follow the national guidance at each stage of unlocking. But I would like to sort of pay tribute to everybody in our community who has helped to bring those numbers down. That is a significant improvement since where we were at the beginning of the year, and hopefully we can continue to see those numbers at relatively low levels over the coming months, but accepting the fact that we will see clusters and sometimes some individual outbreaks, which of course we would investigate and try and action as quickly as possible. So that's a broad overview of the numbers there. I thought, moving on to the next slide, it might be helpful just to show that geographically, and you'll notice there's a link underneath that, and that's updated daily. So this is the rate of cases in each of our medium super output areas, which is around about 7,000 people, around about that level of population. And it shows that those very high rates that we were seeing a few months ago have fallen away significantly. We still have some slightly higher levels, mainly concentrated in our higher population areas, so our main towns, not exclusively. And we would expect those patterns to change, and day by day you see the numbers going slightly lighter or slightly darker depending on how many cases in that particular medium super output area. And sometimes you will get numbers going up because you'll have potentially an outbreak, a specific outbreak within that area. And because it's low numbers, a low population base, if you get just a handful of more cases, that can push the rate up quite considerably. That's something that is a challenge for us in North Somerset with our relatively low population base. You don't have to add that many cases to see the rate go up quite quickly. So it's just to sort of give that health warning that numbers will change, but it may be because we're dealing with a particular situation, and those could occur in any location at any one time because that's the nature of the virus. The main thing is hopefully we try and identify it early and work with people to stop further transmission. So that's a geographic representation of what's been happening. Just moving on to the next slide, which is encouraging, and this is the positivity of the tests that are taken. Oh, do you want me to stop there?
Sorry, Councillor Parker, I was going to call people when the presentation was finished. Sorry, I should have been
I wanted to ask a question on that particular issue.
Okay, I'll tell you what, we'll do it after each slide. Is that all right, Matt? If I take questions after each slide.
Yes, of course. Yeah.
Go on, Councillor Parker.
Please do.
Yeah, and unless I'm being thick, what's the significance of the suppressed areas?
So those are numbers that are so low that they're not reported because you could potentially be identifiable to individuals. So it's a normal sort of practice in health-related statistics that at very low numbers you tend not to report them. So it's an area where those numbers are so low that they don't include them.
All right, that's fine. Thank you very much.
Do carry on. There's no other questions.
Okay. No, I can understand though, because the term suppress sounds a bit conspicuous, doesn't it? Really, but it's just it's a fail-safe, I suppose, to not identify people. So just going back to positivity again, so it's a bit like the previous trend where we saw the cases come down. Thankfully, our positivity has gone significantly lower than it was back in January, and we're comparing well to the Southwest. That number has actually dropped very slightly. We're at 1.2% on the latest statistics, so that is encouraging. If we can keep that level low, that will hopefully be a sign of transmission being relatively under control within North Somerset. Just moving on to the next slide, this is just a comparison of the cases by age range. These are quite broad age ranges, and there'll be nuances within this, but I guess it's just signifying that alongside the Southwest, probably our peak areas are in working age adults, and we may expect that anyway, because a lot of these cases may be in people who can't work from home or are providing essential services, so therefore will be out in the community more, coming into contact with more people, and then at slightly higher risk of becoming infected or possibly passing infection on to other people. So part of the challenge for us going forward is how do we work with that age group to keep them as safe as possible? And I suppose one of the elements that will help to support that is regular testing. And we're seeing the expansion of the lateral flow testing program in workplaces and associated with some of the unlocking steps, for example, the ask of parents, carers and support bubbles for students returning to school to also do regular tests to try and keep an eye on whether more cases are being, are circulating in the local population. So nothing too far out kilter with what's happening regionally there, but something to be actively managed as we go forward. Moving on to the next slide. So this is just about a kind of verbal summary of the fact that, things have improved, but I guess it's also a kind of note of warning, and this is one of the national tests that's been put alongside the roadmap to unlocking, saying that we do need to keep an eye on different variants of the virus. Important to say that there's two categories in there. There are variants under investigation, so this is about surveillance work where you'll identify some slight changes in the virus and you'll keep a track of that as effectively as you can, but as long as it's not having a significant impact on health outcomes, on the likelihood of people being hospitalised, for example, and it's not having a significant impact on the efficacy of the vaccine, then that's of less concern. But the variants of concern is another element, and that's what we saw in the situation in Bristol and South Gloucestershire, where additional testing was done across large postcodes to try and make sure that any potential spread of those variants of concern had been contained, identified and contained effectively. So North Somerset, like every local area in the country, has sort of contingency plans to try and deal with that. And we will be, we're learning from the experience of our near neighbours and other parts of the country, but it's something we need to stay alert to, and that may change plans in the short term or medium term if there were other, actions that we needed to take. We'll continue to respond as effectively as we can to the clusters and outbreaks of cases, and our work around outbreak management has been going on throughout the pandemic. Interesting to reflect that when the pandemic started, that was very much an area where Public Health England had the sole responsibility. And as the numbers of cases and the situations became larger and more complex, we've had to develop much more capability and response in the local authority to step into that space and run regular meetings with, for example, colleagues in the care home sector, education sector, and specific work with workplaces as well. So, that's been quite a challenging area of work, but one that I think we've worked well alongside our colleagues in Public Health England. But as the system changes in nationally, so that's the development of the National Institute for Health Protection, which will replace the health protection response of Public Health England. We'll need to think carefully about what are the relative roles and responsibilities at national, regional and local level around health protection, and making sure, particularly at a local level, that we have the appropriate resources and capabilities to be able to respond to any of those expectations. So that's something that's in progress at the moment with the development of the National Institute, and we would expect to see more detail on that coming through in the next few weeks. And I guess the other thing just to recognise is in terms of the evidence base about how effective the vaccine is, both in terms of reducing health risks and for interrupting transmission, we're seeing some early data around that, and that's generally encouraging, which is really helpful. But we'll continue to watch as the evidence develops in that area, and we learn more about what is the most effective way to interrupt transmission. So hugely grateful to colleagues in the research world as they build the evidence base as we roll out a programme. That's quite an exceptional thing to do. Normally you would do a lot of this planning beforehand and monitor, obviously, but it's a bit of both happening at the same time now because of the speed at which we've had to develop a vaccination programme. So no questions there. I'll just kind of move on to a couple of other areas. So this is just a graphical way of showing some of what I've talked about already, but some of the key work streams that we've been managing at local level sort of within the public health team, but this is very much working alongside partners within the council, within our local area, for example, CCG, local health providers, our colleagues in police, wherever it might be, and also then working up with national systems. But it's sometimes helpful to just give an overview. We've talked a bit about outbreak management, and that's something that we'll continue to actively monitor and work with, because that's really important to try and deal with outbreaks as quickly as possible. Testing I've mentioned a little bit, and I'll come on to community testing in a moment, but also to recognise that the PCR testing, so that's for symptomatic people, we've continued to have good coverage for North Somerset with sites in Clevedon, in Weston-super-Mare and at Bristol Airport for people to get those tests quickly. And there's been good capacity in those for a number of months now, after some challenges that took place at the back end of last summer and early autumn, where access to testing was difficult for some people to get. Contact tracing, so that's something which has been led nationally, but alongside other local authorities in the southwest, we've now developed a complement to that in terms of a localised system of contacting people who have not been reached by the national system, and within 24 hours of them trying, if they're not successful, we're using a local call system, and we are finding that that's helping to get through to some additional people, and also helping to build a bit more local intelligence about what has been happening and how to manage risk appropriately. The insight, communication and engagement, so this is about how do we work with our local population, how do we support those protective behaviours, what are the barriers that people might be experiencing, and how do we nuance the messages at different stages of the pandemic to make sure people understand what they can do most effectively in that moment, alongside the core behaviours, the kind of hands, face, space message, then the more specific things that people can do. And I think that's really important as we look forward to the unlocking, how you can tailor messages so people are clear about what's appropriate at each stage of that process. I put enforcement there, but it's probably better to say education and enforcement, because ideally what we're looking for is working with people rather than, working with people rather than just enforcing a rule. The more we can get people to work together and do that naturally, the better. But we have built good systems of sharing intelligence and coordinating our activities across our different teams within the local authority, and particularly with our colleagues in the police as well. So we've got situations, for example, where we did a recent audit of supermarkets and their COVID secure practices. That was a combination of colleagues in regulatory services in the council and PCSOs going out with those colleagues, so that we're able to get the same intelligence about what's happening and then plan for areas where we think we might have more concerns. But we have done some enforcement work as well where necessary, but that has tended to be at the far end of people or choosing not to listen to the advice that's being given to them. We've also used the Marshals Fund, as it was called nationally, not how we've called them locally. They're community support officers who are out and about in our community trying to encourage people and share information about what's COVID safe behaviours. And then alongside that is our surveillance and intelligence work, so working with our colleagues in business intelligence in the council, but also with those equivalents in other agencies, making sure that we're understanding what's going on, sharing intelligence as much as we can, and then this work to look ahead as well and try and predict where patterns of demand may come, and get ahead of the curve as much as we can in terms of prevention, rather than just responding to clusters and outbreaks. I'll come on a little bit to vaccination at the moment, but clearly that's a significant intervention that's changed over recent months with huge benefits for our population. And I also wanted to highlight the work around the community response, which has been outstanding, I think, in North Somerset, the way in which different agencies in the voluntary community sector, plus our town and parish councils and all of those local stakeholders have worked to protect our local residents, to understand need in different ways and make sure the right resources are being targeted in the right way to help people stay safe, but also do things like access vaccinations when they're called as well. So I think a huge area to be very proud of for a lot of people in North Somerset. Just going to move on to community testing. So it's just a reminder that we've got the difference between the symptomatic and the asymptomatic testing. We've got our 3 community-based locations. We also did some good work piloting this approach with Western College. That approach, in terms of our staff running that site, ended at the end of last week, and a huge thank you to all of the colleagues who are involved in that. So Western College are now running their own testing system, which is working well for their students. We're now in the position where we've got access for the support bubble, so that's parents, carers, and anyone else who may work with those students, to access assisted testing in our 3 locations. We're also now working with the national system to make those points at which people can also collect self-testing kits and take those home, because we know for some people that taking a supply of kits will be an easier and more practical way to regularly test themselves, as opposed to always having to come into a site to do it in a supervised way. And we would expect this pattern of extending that type of approach to go further as we see the unlocking take place. So, for example, when we move into the world of non-essential retail, for example, some workplaces, and in fact all workplaces, can run their own testing regime, but some may not be able to do that quite so easily, but we'll continue to offer access at our community sites for people to get a test, either in person or some to take away if that's what works best for them. So we will do what we can to support that national process. That's just an example of actually how easy it is to book online. You can use quite an easy grid system, pick your date. So that was just for today. This was done a few days ago. Pick your slot, go ahead, get your test done, and then it's quick, it's easy, it's painless, and the staff have been very good in terms of the way they've supported people in those places. Just move on to vaccination now, and just to recognise that there's some increasingly good data that's being published week on week. There's a national system for doing that, run by NHS England. I've put the links in here, so if people want to look at that directly, you can look at North Somerset both in terms of as a whole, but also by those medium super output areas at a more detailed level. But I suppose in summary, what we have seen is a huge rollout of vaccination. We've had over 87,000 doses administered to people in North Somerset as of at the end of last week. We get a new tranche of data every Thursday. That's when it's published. So as of last week, so we've gone up from that level. And we've got helpful updates on the CCG website as well, which gives more detail about access points and how the program's going. So the overall message is, yep, things are going well. That data there is slightly dated because that was 28th of February. I was giving you the over 87,000 as of the date last week, which is the 11th of March. Important to recognise as well, there's been some discussion about eligibility criteria, and that is set nationally by the National Committee, and that's confirmed that delivery will continue on an age basis rather than by any other measure. There's some question about whether it will be by occupational group or other risk factors, but it's been done on an age basis, and I think that's we have to respect the judgment of the National Committee on that. They will have weighed up all the evidence and will follow that guidance, and that's what colleagues in the NHS are doing and have done an amazing job in rolling that out so quickly. I just thought it might be worth pausing as well, just reflecting on the fact there has been some discussion about vaccination today, following some reports yesterday about interruption to supply of the vaccine. So I think we've had a statement from the Secretary of State of Health today giving a bit more detail, and it is just underlining the fact that there will be sometimes some slight variance in how the supply comes through, but I'm sure everything is being done to try and get that supply up as quickly as possible, and colleagues in the NHS will be working to a very clear programme of who will be called next, and how to do that alongside the administration of the second dose as well. Important to recognise that we're getting through that cohort of people as well now, particularly in the older age groups, and those people will start to achieve the best possible effect they can have from vaccination with the second dose. So I probably won't go into too much detail about the other slides, but this was just the recognition of the tests that are being applied.
Question literally
Got a question
dropped in. Councillor Parker. I think you've muted yourself and then put your hand back up again.
Yeah, sorry. I was going to ask Matt about whether or not he was disturbed about the suggested long delay in getting further supplies of vaccine, but I think he's covered that now. Mr. Hancock seems to be happy with it. I assume you are as well. Are you, Matt?
Well, I think it's one of those things we just have to accept that he's part of a programme of receiving supply. We're seeing supply issues across countries, across the world actually, so it's not like it's exclusive to this country. There are ebbs and flows in vaccination supply. I mean, it's been such a huge logistical effort to set up the additional capacity to produce vaccine. I think it's fairly inevitable that you will have little moments within that vaccine supply. So I think we just have to accept that that's where we are at the moment, but everybody will be doing everything they can to make the best use of supply as soon as it comes back online.
Councillor Parker, is that your old hand or new hand?
New hand. Yeah, thanks very much for that there, Matt. I know that care homes across the town are concerned, excuse me, are concerned that they haven't been told when the second dose will be administered. Have you any idea when that might be?
Yeah, so that should be working with their local GP practice in terms of the process for recalling people for their second dose. So I'm not sure. I mean, we can take that offline if you like in terms of there's specific questions from care homes, but I know colleagues in our primary care network, so the GP colleagues, have been working really hard, both in terms of when they set up the initial doses in the care homes, recognising those are priority areas, but also trying to make sure that we get good coverage of second dose as well. So if there are particular issues there, I'm happy to pick that up with you.
So John Heather's just put his hand up, so I assume, John, you can pick that one up.
Quite sure why anybody wouldn't know, Ian, because actually the second round of care homes started today. We would have done all of the second round within 9 days. So by the end of next weekend, they will all have been done. So the care homes have been communicated with. It's not always easy to get them to communicate back, but we have a team working on it fairly intensively. And at this very moment, there are teams of clinicians out in the care homes delivering the second round of vaccines.
Okay, thank you very much.
We've got Councillor Haverson and then Councillor Cherry. I assume it's on this vaccination.
No, I was actually going to go back to the testing and tracing, if that's all right. I didn't want to interrupt at the time, and then we went into vaccination. So there's basically, I just wanted to see what, Matt, your judgment is on this. There are two items that particularly concern me about the test and tracing scheme, and that is that close contacts at the moment aren't entitled to tests. And the second is effective support for those that need to isolate. I'm really pleased that our local authority is now involved in the follow-up for the tracing system, and I'm wondering how quick that can happen. Is that in time, or is that delayed because of the long communication channels? And how would you like to see that evolve ideally in the future, a combination between national and local responses to things like this, where we support each other, but with much faster communication channels?
Okay, yep, I'll do my best to answer those questions, and if I get any of them wrong or the nuances wrong, come back to me and make sure I'm answering the right things. So in terms of close contacts and testing of close contacts, that might be something that changes over time, but at the moment we're in a situation where we're following national guidance on that. With the numbers coming down, we might see slightly different approaches to the response around individual cases when they're identified. No suggestion that there will be additional testing of contacts at the moment, but that might change in time. I think in all of this, we're trying to learn about what is most effective, and with smaller numbers, you potentially have more scope to be able to set up systems that can work in different ways. And of course, we do have some benefit potentially from the regular testing of people through the lateral flow test to help find more cases as well. So there's a bit of a mix there, isn't there, in terms of people who are directly symptomatic and those who are asymptomatic. We've got more options now, I suppose, which is good. But we'll see whether, particularly with the setting up of the National Institute for Health Protection, about whether they might adopt slightly different approaches. Important to say on that point about relationships and you know how things work at the moment in terms of legislation. The health protection function very much sits with the national agency rather than at local level. So our role in local government is to assure ourselves that the right things are being done, but we don't necessarily directly control resources. We've grown into that space during the pandemic, and I think that's been hugely beneficial in terms of being able to understand our local area, work with our local stakeholders and manage those relationships well. Quite what the future might look like and the expectations of local authorities going forward, I'm not sure, because I don't think we've had enough on the national system yet to be able to understand that. What we are planning for is to have some capacity and ability to respond at a local level in this next financial year, and probably the one after that, because we know COVID will have a long-term impact. And also we want to try and make the most of any opportunities we can to improve health protection at a local level anyway, because there could be associated benefits around things like flu, norovirus, whatever else it might be, where, if we have a better system, then we could get a better response in a number of areas to reduce risk in our population. So I think that, there's still a bit of work to be done there, but I can certainly see how you would want to have a complementary role for local areas and some say in how we move things forward. Quite where the resources sit and what the mix of local versus regional or national activity is, I think is hard to say at the moment. And I suppose ultimately that's a national policy decision. We will lobby through the Association of Directors of Public Health, through the Local Government Association, through the Faculty of Public Health, to try and make sure whatever comes out, ultimately, it does the right thing by our local populations. It reduces risk and it improves outcomes. You can cut that a few different ways, but I think if we keep our eye on the prize of what is best for people and reducing risk, then we should get to a place where we can all play a part, an appropriate part within that overall structure. So still a lot to be worked through on that. You asked a question about isolation as well. So there have been some national studies on this and some pilots in other local areas, which we'll wait to see some evaluation of about what additional support mechanisms might be important to enable people to isolate effectively, recognising that in particular probably financial barriers are one of the main issues, and some of those people who are less likely to isolate are probably the ones you'd want to isolate in terms of their the way in which perhaps they might mix with other people and move around the community. So again, that's something where local pilots are happening. The Joint Biosecurity Centre, which is the national kind of intelligence work around that area, is looking at that at the moment. So I hope we might get a bit more, and then a bit more of an understanding of what we could do locally to try and enhance that, whether that's through government grants or different approaches, I'm not sure. But we have, we have tried to provide the support that we can through those national systems as quickly as possible locally. But I do appreciate that for some groups, it's still a barrier isolating, and they practically are really struggling to do it because they still need to earn an income.
Thank you. We've got Councillor Cherry followed by Councillor Willis.
Thank you very much. I was delighted to hear how much work has been done on helping communities understand the risks, and I appreciate that largely it's been face, space, etc., and that we're relying on the vaccination to really damp down this terrible virus. But unfortunately, while our economy is unlocking, my concern is that maybe we should be also speaking to local shops and pubs and things as they open up, and mentioning about ventilation. And I know that Karen has mentioned this as well, because if we can address ventilation, it would be really, really, really good, because there's still going to be a risk and there may be new variants. So if your group can address that with businesses, it would really, really help. Thank you.
Thank you. You raise a really important point there, and that's certainly one of the areas where we're doing some proactive communication. So I know both within the economy team, the licensing team, and the health and safety team, we're doing some proactive work with our local businesses to try and make sure that we're getting all of the latest guidance to them as early as possible, but recognising the fact that some of these things take time, because the detail of the national guidance and regulation can sometimes follow sometime after the main national announcement. But we certainly will be picking those up, and I agree with you, ventilation is an area where possibly a different level of response is required to make us as safe as possible.
Thank you. Councillor Willis.
Thank you. So my point is really for Dr. John Heather, who I know is on, as well as Matt. I think it would be good.
Just want to check, you've frozen on my screen. Is it just my screen or everybody else's?
No, I think it's everyone's.
Frozen.
Yep.
Yeah.
Because everyone's.
She's frozen. She's frozen.
Okay. I think what we'll do, not that you can hear us, I think Councillor Willis, we'll carry on, and then when you pop back in, we'll get you to ask your question again. Is that all right, Matt, for you to jump back in?
Yes, that's fine. Yeah. So given that we talked a bit about, I won't go through all of the slides about the stages of unlocking, because it's probably not that helpful at this stage. I mean, lots of people are aware of this, and we've talked a bit about some of the principles we need to apply in that unlocking, which I think is the important bit. So but yes, I mean, I guess one of these things where we're sort of conscious of the changes that are coming. I think we'll work as closely as we can with everybody in terms of local partners and the community to try and carry everybody through this as safely as possible. But certainly in terms of members of HOSP, if there are opportunities that you spot to be able to do things better, or concerns that you have about things that are happening in your local community, then please do share those so that we can try and get on the front foot as much as possible, because the earlier warning we get, the more chance we have to intervene effectively. So perhaps that would be my sort of final plea to colleagues on hospital. Keep us in touch with the concerns as you see them, and I'm sure we'll do better with that type of intelligence coming through.
Excellent, thank you. Councillor Oswell, are you back? You're on mute on our screen.
Yeah, I wasn't on mute. I was talking and the whole screen disappeared and I lost the connection here. So it just went.
We can hear you. So do you want to ask your question again?
I'm back. Right. Yes, I'm back again. So I'd like to take this opportunity in the hosp to actually thank John and Peer Health for the amazing organisation and work that has gone into this vaccination programme here for us, because we've got a lot of negatives have been spoken about with the new surgery and all those bits and pieces, but I don't want anyone to lose sight of the huge amount that has been done along with North Somerset, but specifically for Peer Health for getting us where we are. Volunteers, wardens in the car park, the whole thing has been absolutely magnificent. And I haven't had any residents' complaints on it. And I can only say, having been there myself, how wonderful it is. So, I think it would be good. I just like it on record on the hosp to say that, regardless, we get all the brickbats, we get all the nasties, we get all the negatives sometimes about what we do. But I would like it on record to say, well done, John.
Thank you, Ros. Much appreciated. I will feed it back to the team, and it has been a magnificent team effort. So I'm here to take the plaudits and appreciate that. But actually, there's a really superb team of people there working hard to deliver it.
And I echo those. Councillor Mike Bell and then Councillor Parker.
Thanks, Kieran. I just want to totally associate myself with what Ros has just said, and also, not just Peer Health, but all of the practices and primary care networks in North Somerset and across the CCG area, because we know that all of them, and particularly in North Somerset, and we can be rightly proud of our teams in North Somerset, because they have really been, star performers across the board, and all the feedback has been immensely positive about the kindness and consideration of the staff involved. And I think it must be quite refreshing to those in general practice in particular, because we're always used to the complaints about how difficult it is to get hold of your GP practice and that kind of thing. But I think this has been an exercise that really demonstrates the value of the NHS to us all. So absolutely big applause to Peer Health, Mendip Vale, Portishead Medical Group, and all of the others that have been so active and so effective.
Excellent. Councillor Parker? Going to say those infamous words, you're on mute. Well, that's an old hand.
I always forget that. Yeah, I was saying, I also want to add my plaudits to the previous two speakers. The operation at Riverbank is absolutely first class. It's really slick. And when I see examples on television news and what have you of people being taken into other centres, they're sat down, they take their coats off, they have a cosy little chat and all the rest of it. I think, blimey, by the time they've done that, if they were at Peer Health, Riverbank, they'd have inoculated half a dozen people while one's sitting down. Really slick operation, first class, and well done to everybody.
Thank you, Ian.
Excellent. Any other speakers before I wrap this one up? No, I would. That's an old hand in. So yeah, just kind of echo really what everybody has said. I mean, if minutes have a structure, don't they? But you kind of want to bold and underline and put in bright red everything we just said there, and all the fantastic work you've all done. Like the speed of the vaccinations, astonishing, and the community testing facilities. I know because it's one in my ward. How quickly that was set up was out of this world, really. So yeah, absolutely. Echo what everybody else has said. If we can bold it, underline it in the minutes, let's do that. But otherwise, I think you'll have to take our word for it. So just moving on. So I'm really mindful of the Graham Road relocation proposal, and obviously, Dr. Heather, you have a time commitment. So if I propose we jump the Graham Road relocation above Healthy Western impact monitoring, do I have a seconder, and is everyone okay with that? Yeah, we'll call you there, Ruth. So that's fine. So we've got a seconder. Anybody dead against that? No. Okay, we know where this is going. Okay, in that case, Colin and John Heather, do you mind doing the Graham Road relocation proposal?
Yes, thank you, Chair, and good afternoon, everyone. I'll start, if I may, and then I'm going to ask John to talk a little bit more about the vision for the new health centre to replace the Graham Road facility, and finally, my colleague Claire McInerney will just wrap up. You'll have had the slides in advance and hopefully had a chance to look at them, so I won't go into those in detail. Perhaps it might be helpful if I just start by acknowledging the comments that were made in the earlier part of the agenda about the public concerns around the location of the new centre and access. I think just to state what councillors will all be aware, but to reiterate that first and foremost, this is about making sure that the Graham Road practice has a fit for purpose future location to serve the patients on that practice list, and any process to close down a surgery and replace it with a new building obviously has to be very mindful of the fact that we need to put the new practice within a reasonable distance of the old practice, and so you really won't get a perfect spot that will sort of serve everyone equally. But what I'm really keen to stress, I think, is we want this to be seen as a wider ongoing programme of work. I genuinely think that the new practice will improve the primary care offer overall in Weston, not only in terms of the physical estate and the building, but also in terms of things like staff recruitment, and John will say more about that later. And you'll see that we're planning to an extensive piece of consultation with patients and stakeholders, not only about things like the layout and access of the building, but also about the service model, how we can ensure that the services become more of a one-stop shop to include a wider range of healthcare and wider voluntary sector provision for the people living in and around there. And of course, there are other opportunities that the hospital will be aware of, such as the advances in what we call telemedicine, so the ability to monitor people with long-term conditions remotely from their home, and the results being sent through to the practice to reduce the amount of travel that is needed. And of course, councillors will be aware that we're looking at mitigations around things like improved voluntary transport schemes, the like of which we have well established in other parts of North Somerset as well. But just to reiterate, I guess that moving between 12 and 15,000 patients from one building to another will not solve all of the problems for a population the size of Weston-super-Mare. And there is more to do on that. We're absolutely clear on that, and we'll talk a little bit more about that, about understanding the additional unmet need, particularly for the people that live in the heart of the town, although not exclusively. And we do know, of course, that there is unmet need, because, for example, people who live in the town centre in Weston, we know from the data, disproportionately use the A&E at the hospital, and that requires something like a 3 or 4 mile round trip to get that service, when in many cases the sort of conditions that people are attending the A&E for would be much better treated at a modern primary care facility. So we have some real opportunities here to take stock and, as I say, as part of a wider programme of work, move forward. I'm going to just now, if I may, share the screen, Chair, just so we can go through the presentation briefly. As I say, councillors will have it in their packs, I know, but just so we can sort of go through there. So another one of the Microsoft Teams cliches is, can you see my screen?
We can indeed.
Excellent.
I'll take that one off the bingo list.
Thank you. So the overview is you'll be well familiar that we, some time ago, and I think one of the things we're keen to stress here is that we feel we have done a fairly exhaustive search of the available estate within the sort of Western area to use the £3.2 million worth of capital money that was allocated. As you can see, 17 potential sites were considered, and the rugby club option that we're putting forward was a clear winner, even though we'd gone through such an extensive sort of consideration of the different options. And as I said already, we'll have a period of engagement and consultation about what the new facility could look like, what it would do, how it will take opportunities in terms of the sort of ever-changing face of primary care provision, strengthened and accelerated by some of the necessities caused by the COVID pandemic. And we look to get final sign-off for a full business case following the consultation later on this calendar year. The range of site suitability criteria that all programmes of this nature go through, and other councillors in other parts of the forest will be aware of the Parklands Village development, which is a very similar sort of process we've followed in terms of identifying a potential new site and an equivalent closure of a practice nearby to ensure that list can transfer, although that's slightly different given the new housing there as well. That's a list of the site considered, and you'll have had within your papers the outline business case that was developed by the team, which gives further detail on the process we went through to get to the shortlist and then the final proposed site. Of which there were 3 in the shortlist, and again you can read at your own leisure the detail of that, of how we went through that process within the parameters of essentially affordability, achievability and access requirements. And there you'll see the list. One of the attractive parts of this proposal was the fact that there is a major piece of regeneration planned for that wider surrounding area, and we think that will be a great benefit to the wider council regeneration plans to have a state-of-the-art and large primary care facility within that development. And again, this slide here just gives a little bit more context as to where the proposed site will be, working with our partners in Studio Hive. So that's the sort of background to that. I'm going to now ask Dr. Heather to talk a little bit around. If you're right, John, I'll continue to share my screen, and perhaps sure. If you would like to take over sure. the summary there.
Absolutely. So I think for us the key thing is obviously Graham Road is pretty grim and desperately needs somewhere to relocate to, and the sooner the better. Within that new development, there's an 1,100 square metre state-of-the-art healthcare facility, which we've worked with the developers, and that's not just me, but that's been designed with lots of the clinicians and staff from within Graham Road, so that we're going to have something there that is, we think, really excellent to meet the health and care needs of the local population. I was reflecting in thinking about coming here. You can tell I'm not young. So I've been a GP for 30 years, and in that time general practice has changed enormously, and it's now really a primary healthcare team that together that team deliver the care that's appropriate to patients' needs. And I was just thinking, what sort of team would you have in this building? And it would be GPs, advanced nurse practitioners, practice nurses, HCAs, nursing associates, physios, mental health, paramedics, pharmacists, care coordinators, health coaches, admin staff and management. And I'm sure I've missed some, but that's an enormous team, and it needs a facility that's going to really give them somewhere to be at home and serve the patient needs in the best possible way. So some of these things here is built over 2 floors, and it gives us a real opportunity to join up care and to work with some of our community partners, so Serona and AWP. I mean, the whole talk about the future of healthcare is around integrated care partnerships, and this would be a fantastic opportunity for that to happen. It has a triage room, which has been specified in the layout, I believe, from one of my colleagues in the CCG. It's the first one of these of this type actually in BNSSG. So it's a space dedicated for video and telephone consultations, and that's one of the other changes that's happened to general practice, is that we have become much more digital savvy. Obviously, Weston will be now well known for Ask My GP, and certainly prior to COVID, we were using Ask My GP, and that had reduced our face-to-face patient contacts by to 40%. So we're able to meet patients' needs appropriately without having to see them face-to-face physically in a significantly smaller number of ways, which is face-to-face, which is, really, I think, quite an important thing. One of the things that you may be aware of is that the GP contract allows for what we call additional roles reimbursement roles. For peer, that will be £2.5 million by 2024. That's 48 staff. The thing about staff is you've got to have somewhere to put them. And one of the big cries across the NHS really is we haven't got enough room, and that's certainly true in peer. There are also some other sort of really quite exciting opportunities because this is close to recreational and green spaces and links to the new rugby club sporting facilities. So that gives us lots of opportunities for increased social prescribing, things like garden allotments, and also patients being able to use sports and gym facilities as part of the wider development, which, when we think about the lack of physical activity and the increase in obesity that's been highlighted within COVID, it's a really good thing. I think it's you can't underestimate the how important good facilities are to recruiting staff. I was part of New Court Surgery that relocated to 168 to 168 Medical Group in Locking Road, and the difference in being able to work in that facility was just absolutely amazing. And of all the practices in Western and World, we have the least difficulty recruiting staff, and we actually have the biggest care team. And I think because of that, we're able to provide really excellent care to our patients. And the question is, why is that? And it's because we have a good reputation, but it's also because we have a great building. Western is not an easy place to get people to come and work. And, so you have to ask, why will someone want to come and work in Western? And in particular, then, why, if they're going to come and work in Western, would they want to work in Graham Road? And having great facilities is important. I think when we met at the pre-hosp, I was telling you about the locum agencies and the doctors who come to work as locums. Not that we want to promote locums, we want to promote substantive posts, but it's an interesting insight into the way that people think. The questions they ask: is there a car park? Do you have carpets? And where can I have coffee? So it's interesting. And I think the other thing that this secures is you end up with being able to possibly retain the Graham Road in-house pharmacy in this location, which, if the practice moved into the centre of town or somewhere like that, we would have lost that because there's so many existing pharmacies in the town centre. So, so that's the reason why I would welcome this project. I think it's great I think it's great for patients. I think it's great for general practice in Western. And I really, my vision for the patients at Graham Road is they get at least the best and not the worst. And that, in many ways, until recently, that's what they've been having.
Just before you move on, John, we've got Councillor Ros Willis wants to ask a question and Councillor Sandra Hearn. Ros, do you want to go first?
Thank you, John. So can I ask, on paper, Dolphin Square looks perfect. It looks wonderful, and it looks like it would be quicker because it's not a build, it's already there, and the paperwork says on the options appraisal that it'd be quite easy to do, etc. I know it says there's no parking, but there's a blooming great multi-storey car park opposite, so that's that isn't a problem there. And I'm just wondering why that was, taken out when we've got units sat in there that have been empty since they've been built, plus other ones that are going. And, is it because the Homes England money is part of this build? Is that why the reason was taken? Because I still feel that, personally, it's only my personal view, that Dolphin Square is a good place to be for it because it is so easily accessible, and also to take away from A&E when we're busy on the seafront, you know, on a manic 10,000, 15,000 people coming in, it's just off the seafront.
Sure.
I
So
think Tim James has jumped in. I don't know if he's going to respond to that. Sorry, John.
Right. Thank you, Kieran. I'm happy to let you answer, John, but happy to support as well.
that's fine. I mean, you start and then I'll give you the clinical view.
Thanks, John. Thank you, Ros. Yeah, Dolphin Square could have been great. And in the first round of the options appraisal, we were looking at the units. There are two separate units which are facing that multi-story car park, and we were looking at the option of turning them into a single unit and using that. It would have had challenges in terms of natural daylight getting to the back of there, which is absolutely essential for GPs. Need natural daylight in order to be able to, consult with patients and look at particular conditions. But yes, that was a real good option. Unfortunately, the landlord there went for another potential tenant. They had a leisure provider. It might be a bowling alley or something that they preferred, and so it was withdrawn from us. In the next round, we were offered some other units which were on the other side of that facility, which I think is an ex-restaurant and some part of a gym, and they were sort of a bit labyrinthine and buried right sort of deeply into that larger building, and they would have been a bit of a black hole type arrangement. It was smaller. It was too small, really. You would have been squished in there. There wouldn't have been any natural light. It just wasn't great, and it was again the other side of the building from the multi-story car park, and there wasn't very good drop off for patients. So all round, whilst the location was appealing and the first option there in that development was appealing, it just didn't stack up ultimately.
I think that's absolutely true too, Tim. I think it's interesting that this journey has been a long time in the making. And what often happens is that, I can remember having a number of coffees when we were allowed to with Colin over this period of time, and he would tell me about another possibility, and I get all excited about it. And then we'd go and look at it, and I get even more excited about some of them, not all of them. And then we'd work it through and realize that actually, oh my goodness, we can't afford this, or it doesn't fit in with all of the other things that are going on, or there's some other piece of information that comes along. So this has been quite a journey to get to this place. It hasn't been as straightforward. I mean, we're here talking in very black and white terms, but it's been quite an emotional roller coaster, I think, trying to find something that really suits. And I think, like Colin says, everything is a compromise. No one solution is going to deliver everything for everybody in Weston. So it has to be part of something that is far more of a comprehensive answer than that. My particular favourite was actually TJ Hughes. I could dream about what could do there, because I think it would be a wonderful opportunity to regenerate that particular part of Weston and join up Dolphin Square and the High Street, and you sort of think, wow, that would have been great. But it was at one level too big, and the money didn't add up together, and there was all sorts of reasons. But I remember going around it and looking at it and thinking, wow, there's just so many possibilities here. But in the end, when you put all of the options together and then you risk score them, you whatever we call it, you do the options appraisal scoring. Graham Road actually, sorry, not Graham Road, but this particular building on the rugby site came out so far ahead of anything else, so far ahead.
Thank you. So gossip there on a bowling alley, that's been talked about for years. Councillor Hearn, and then it'll be Councillor Havison.
Thank you. I'm going to return sort of to what Ros was saying around Dolphin Square. I noticed on the list that was on page 40 of the proposal that there was land adjacent to Dolphin Square, and it was mentioned a couple of times, but there was no reason given as to why it was unsuitable or what. It sort of kept on getting mentioned as land adjacent to Dolphin Square, but there was nothing else mentioned. That's sort of one query. And my other query, which maybe the exec member was on earlier, they can answer. It says that there is a covenant on the land of the rugby club that the council is the beneficiary of. I'm not aware of anything coming up before council to approve that we can dispense with that covenant, but it's giving in some of the documents that I read earlier today that we're quite happy to not sort of remove the covenant. And sorry, I've got drilling going on behind me.
So Tim, that's first bit's for you about the land adjacent Dolphin Square is. I'm pretty certain that's the Home England's one, but do correct me if I'm wrong.
Yeah, that's correct. Thank you. Thank you both. So exactly, that land is owned by Homes England, who we did engage with several times about it, and they just haven't been in a position to be able to release it, have serious conversations about it. There's apparently a very particularly troublesome electricity substation right in the middle of it, which they need to get permission to be able to relocate, and it would also be very expensive to relocate, which for some reason has just hampered their ability to progress that site.
Thank you. Councillor Bell, do you want to respond to Councillor Hearn's question around the covenant and not coming to exec?
Yeah, just on that point, Sandra. So as part of the planning consents for the rugby club development that was secured a couple of years ago, the council did agree to remove the covenant restriction. So it has been through the council previously, and the only requirement actually is that the site part of the land there is safeguarded as a potential new primary school. So the council will retain ownership of a chunk of land at the rugby club development site, but in other respects, we've lifted the covenant to enable the development in the interest of the community and the rugby club to progress.
Thank you. Councillor Haverson, do you want to jump in with your question?
Yeah, thank you very much. Yes, I mean, taking the three initial comments by the members of the public we've heard, as I understand it, the main issue is access. The access behind the railway line and the distance from various locations. Have we got any plans in the hand where we want to help our residents with facilitating access? Because that, apart from the site being perfect in most other respects, the access very clearly is a major disadvantage. So we really need to pull out all the stops to try and help with that, I feel.
Who wants to pick up that response? Colin?
Yes, could I say something? I mean, I suppose one of the, as I said before, one of the things that's I'm keen to keep in people's minds is that fact that this is part of a much wider piece of regeneration, and we've had a number of conversations ongoing with council officers about the work that would be done as a matter of course if we're going to have significant numbers of extra housing, a primary school potentially, and shops. Then there would already be a requirement to improve access both on foot and potentially road access to ensure that there are easier routes of travel from the town centre to the site. I know, for example, already there are plans in train to improve cycling access, for example, because of course we're all conscious of the potential carbon footprint. But that also, of course, does have to be balanced off by the fact that a number of patients who use Graham Road, particularly those who are older, will travel by a private car or taxi. And one of the things, John, I'm sure will back me up on this, that we continually get concerns about from patients is the ability to park, and to park near to the practice, to allow people who are not particularly mobile to get to the site. So that's an ongoing piece of work. But of course, if it was just we were putting the primary care facility in the existing environment, and that would be different than the longer term plans to you know, do a major piece of regeneration across the board in that area.
Thank you. So I've got Councillor Payne, Councillor Willis, Councillor Bell. What I'm going to suggest is you three do yours, and then we'll carry on with the presentation after that. I imagine that will trigger other questions. Councillor Payne.
Yeah, thank you, Chairman. I'm not a member of the committee, so thanks for letting me speak anyway. For those of us who live in Western Town Centre, we've been waiting for this health centre for a very long time, and I feel that it's very long overdue. What with the closed surgeries that we've had, and the only one remaining, Graham Road, is hopelessly inadequate. So I am really pleased that we do seem to finally be making some progress with delivering this. But I do share the concerns that were raised by the public speakers at the start of the meeting. For people living in my ward, particularly in and around Western Town Centre, the proposed site, which is on the wrong side or the other side of the railway line, is indeed very difficult to access, particularly by any other means other than by car. There is a real lack of other transport options, which I think absolutely need to be put in place. And I am particularly concerned that where health services are too difficult to access, many people, particularly certain vulnerable groups and so on, simply will not access them. They might increase the number of inappropriate visits to A&E, or they may simply miss out on vital health interventions that they need. So I feel that this could have real implications for local people's health outcomes by locating it in this site. Thank you.
Probably a statement more than a question. So, Councillor Willis.
Thank you. So a couple of things really on that. As has been already said, we've waited an awful long time for this, and there's been a lot of talk on it for many years. And I'm pleased that we have got this far. And it's exciting to think we are this far. Nothing is perfect, as others have already said. And you know what, even on my ward, I live on the highest part of Weston-super-Mare, up by Worlbury. And to get to Milton Road surgery, it's 4 buses, 4 bus journeys, and about 4 hours, because they don't run regularly. And if I want to go to my doctor's surgery, I can't go after 3 o'clock in the afternoon, because my last bus back up the hillside is 5:20. So none of us have easy access. You don't have to be in the centre of town to have uneasy access to somewhere. So, you know, I fully understand the situation, but we do have this new bus strategy coming into place, which is helping with our public transport now in North Somerset. We're looking at, you know, commercial, etc. And I think that needs to be flagged up as could be part of the solution with the new bus strategy to take people's worries out. There may not be a bus service now, but it doesn't mean to say there won't be a commercial bus service for when this is ready, because I think the huge opportunities out there now for our commercial operators, not just the voluntary service.
Thank you. So Councillor Bell, I don't think there's a question that, Ross, so I'm going to go to Councillor Bell.
Thanks, Kieran. I just wanted to offer a couple of thoughts as a ward member and a former member of HOSP, and just focus on a couple of key questions that I think are outstanding for me, that hopefully Colin and colleagues can pick up, and Claire can pick up in the rest of the presentation. So I think it's worth remembering that absolutely, totally accept the challenge from the residents at the beginning of the meeting. You know, Ros will remember that it was 8 years ago that the Boulevard GP practice walk-in centre was closed, and we thought that was a bad decision in terms of town centre healthcare. And over the ensuing 8 years, things have not improved, because we've seen obviously New Court, Stafford Place, Clarence Park close or relocate, and real challenges in all kinds of ways in terms of the existing Graham Road practice. So there is no question that people are absolutely entitled in the town centre area to feel a little bit hard done by in terms of their healthcare provision. However, we have to be in the space of trying to fix it, don't we? And I think that notwithstanding some of the issues that there are about access, what would have been the three things that I would have wanted Peer Health and the CCG to do as part of that process. I think I would have wanted them to explain clearly what the options were, how they looked at them, and the basis on which they've made a decision. And I think they have done that. And we may not always agree with every last detail and every outcome from that, but I think you can't say that they haven't set out the basis upon which these decisions have been made. Secondly, I would want them to consult with patients. Now, more could have been done earlier in the process to consult with patients. I think that's fair. I'm sure that they would accept that that's true, because more can always be done on that. But what is key now is that in the next few months, there is a proper engagement with patients, so that the opportunities to deliver the right kind of services and the right mix of services at the new venue are grasped, and that some of those issues around access can be addressed. And I think that's that third point, which I think we really do need to see action on. And that's not just from CCG Peer Health, but also from the council, in terms of how we can improve access to the site and take some mitigations to ensure that patients can continue to enjoy the services that they need. So we've talked about, the importance of improving cycle access. I think that's something that will happen quickly, because we have got proposals to improve the cycling routes across Hildesheim Bridge. So I think that will really help. I think we do need to look at the opportunities for another pedestrian footbridge across the railway, particularly with improved disabled access, so that there are greater opportunities to link between the rugby club site, Sunnyside Road generally, the railway station and the town centre. So I think that's something that definitely needs to be looked at. And I think the CCG and Peer Health will need to look at other access opportunities, whether that's some sort of local bus service or potentially a satellite surgery operating clinics in another location, to make sure that those that are further away, so by which I mean patients living on the hillside, but also where around the area of the former Clarence Park surgery, who are most disadvantaged by the location, can continue to have good access. So it would be really good to hear some ideas from Colin and the team about how they're going to deal with that. But none of that should change the fact that the most important thing is to have access to modern, purpose-built facilities for the people of this area. And I really would challenge the definition that some people have got of the town centre. You can draw lines to suit your argument if you wish, but this site is unquestionably in part of the wider town centre. It is part of the area that we've highlighted as being part of our placemaking strategy, as being part of the town centre. And I think if you look at the patient pool that currently attend Graham Road, this site is at least as, or not significantly less accessible than Graham Road was. So I think the challenge is about maximising the benefits and then getting those transport and access improvements that we can secure over the next couple of years, so that when the site opens, we'll have something that we can be really proud of and will absolutely deliver an enhanced and a quality service that Dr. Heather and colleagues have spoken about.
Thank you. So that's things for the our health partners to consider, I think, as you go through the rest of your presentation. Do you want to pick that back up?
Will do, thank you. I'll just pause for a moment if I may, and thank councillors for their thoughtful questions and comments there. And we're taking this all on board and capturing it all, because we are really keen to make sure that we get the best possible range of solutions for that. So we are actively listening to that. I think there was one thing in particular I wanted to just immediately return to, which Councillor Bell mentioned, was around patient engagement in this, and I think it was mentioned in one of the letters that was read out at the start of the meeting. And I think as Councillor Bell says, we can always do more, but we are keen to do more. This has coincided without trying to make any excuses of a change in the way that the patient participation system is run within Peer Health. But we do. I don't know if John, you want to just quickly update councillors on the recent election of a new patient participation group chair and supporting body.
Yeah, certainly. So, I mean, some of the councillors will be aware of the fact that this has been quite a challenging area, but I'm pleased to report that We recently had a fresh round of elections for a patient lead within the patient participation group at Graham Road. There was 11 candidates that stood. There was 630 votes, which is actually quite gobsmacking, really. I don't know any other practice that would generate that level of interest for a patient participation group patient lead. So that was really quite astonishing. And we have a new patient lead called Jason Sims, who was in place from last Monday, which is great, because we need the patient participation group there to help us lead this patient consultation.
Thanks, John. It was, and we will use that platform to make sure, won't we, John, that we really engage patients very fully on a continual basis. Yeah. Indeed. Thank you very much. Can I just check that people can still see the presentation? Because great. So I'll ask Claire to conclude for us now, and then we can take any further comments and questions. So Claire, would you like to sort of take us on from here?
Yes, absolutely, and thanks Colin and John, and to all the questions today from members of the committee. It's all really helpful dialogue and conversation about this. So yes, just to summarise and conclude the presentation, we believe strongly that this project provides what is a really exciting opportunity to build a new purpose-built, state-of-the-art GP surgery to replace the Graham Road surgery, which we know is not sustainable for longer term use, to meet the needs of the population it serves, and to also house the new health and care professionals that John was mentioning earlier in the presentation. It just simply doesn't have sufficient space to extend or be adapted internally. So we know that it's imperative to move to a new building to meet the needs of that population. Just echoing Colin's earlier point around the fact that this new development at the Western Rugby Club constitutes part of a much bigger regeneration project in what is called the Station Gateway, which Mike Bell also mentioned just a minute ago. And this is going to bring with it a significant number of new houses and public amenity to the area, and infrastructure will come with this. And obviously it's really good to hear from Ros around thinking around the opportunities to work with local transport providers to see if we can get those connections really early on and make sure that these are ready to go for when this new facility is ready in the spring of 23. But I feel like I would like to come back to Mike's points that he raised very eloquently around access and addressing this within the consultation process that we're going to enter into in the next month and into the summer months with the community, and how important it is to listen and hear from members of the community around the issues that they may face accessing this site. We do hear that, and we are conscious that we want to do more work with the population to understand how to address those issues. To note that we will be starting with a series of engagement workshops, which are likely to start in the middle of April. And one of the first ones we are going to run is around transport and accessibility. And what we would like to do is invite members of the community, but also stakeholders who may be able to help us co-produce solutions to this. So the local voluntary care sector organisations who have Western Wheels and others who have a presence in the community, who may be able to help us to develop opportunities around patient transport, but also First Bus and other providers who have their network at their may wish to work with us at this stage to develop that network further to produce a route that would serve Sunnyside Road. So that will be in the first foremost of our minds as we move into this engagement process, and outputs of that will inform, of course, the consultation period that we'll go into around the relocation of Graham Road services to a new facility, and will inform that and give a bit of shape and understanding of what this service will do. And we will talk about what the facility look and feel and what the service model is, of course, within the context of these workshops. But then we may be able to come back with an option around transport and mitigating those concerns around access at the forefront of the consultation period. The other thing to note is going back to the point around one project like this will never, I think, meet the requirements for access for the whole of the town, and that Colin very clearly, just to echo that point, that is something that we need to consider. And what we are committing to within the next year is undertaking some strategic primary care estates planning and mapping around Western, and as part of our BNSSG system work, to understand the level of, and assess the level of need and ongoing unmet need in population, so that we can seek to resolve those access issues from the wider population. Obviously, what we are focusing on here is around the relocation of the Graham Road services and the population that serves. But that's not to say that this won't increase access for the town centre. Of course it will, but we might still end up with unmet need, and obviously conscious of the historical closures within the area and a need to review in line with those concerns as we go forward through that strategic piece of work. So we are very much in favour of doing this work together as part of a partnership and resolving some of these concerns and issues, and thinking about co-produced ways that we can consider improving access in particular, because that seems to be the fundamental issue that's being raised about the site at the moment. And certainly we would welcome this further discussion on safe patient access across the railway. And certainly thinking about a new pedestrian bridge would be a real asset to help connect those residential areas next to around the Graham Road area to the other side of the railway lines. Would certainly welcome further discussions on that point. And also obviously the improvements to the connections and the infrastructure, very much in welcoming the news around the travel path over the Hydlesham Bridge, which I think will help improve the connection time from the town centre. But yes, we absolutely welcome further discussion on that point, and hope to be able to work with you to improve the accessibility and make this what we think will be a hugely positive asset to the whole community once it's built.
Thank you. This is probably a good time to say what my thoughts are on this, because actually I think they kind of almost align really. So we've heard obviously a lot about accessibility and those concerns, and obviously there's consultation going on and workshops and all that jazz. So I'm wondering if, and councillors challenge me, but if we set up a task and finish group of hospital councillors with, I suppose, the function of looking at and understanding the accessibility issues and what mitigations can be put in place, and that can plug into your same timeline you've got with your workshops around consultations. That's what I'm thinking. I know there's some concerns around robustness of assessment processes and all that jazz that was mentioned in the speeches. Predominantly, I think what I've heard today, I'm reasonably comfortable with that, but councillors do challenge me. So I think the accessibility is the big thing that task and finish group needs to look at. Do people feel that is, councillors, that is the right approach, and you're happy to be involved in that? I can see some nodding heads. Perfect. So I'll propose that in a moment. Georgie Bigg, I've just caught your hand. Would you like to ask a question?
Thank you, Chair. Yes, I wanted to say how pleased Healthwatch are that there's sort of light at the end of the tunnel, and there may well be a real quality premises to enable quality services and increase the capacity for the population in this part of North Somerset. One of the things I'd also like to comment on is the involvement of patients and the broader involvement of the community. I understand from Dr. Heather that there has been lots of involvement in the new patient practice group, but unfortunately Healthwatch lost contact with the patient group within the peer group, and Healthwatch has for a number of years networked all the patient groups across North Somerset to a very beneficial effect. I think it gives patients a channel of information, broader information, and also to share best practices across different practices and different groups. So I'd just be interested in the thoughts going forward in terms of maybe coming back into the fold of Health Watch network for PPGs and whether there's any potential for that for the future.
So, Georgie, are you talking particularly about the Graham Road and Horizons PPG, or the Peer Health PPGs in general?
All the PPGs in general, because we not only now Health Watch is now responsible across BNSSG, we're actually working to great effect across the wider area as well. And North Somerset was our sort of starting point, where it was very successful. It's facilitated by one of our volunteers, and the chairs of each of the groups share their information and get information via Health Watch, which is an independent channel.
Sure. I mean, I don't think that there's any concerted effort to break that down. I think it's just a question of, I mean, certainly I would be delighted for all the PPGs to be involved with Health Watch, although I don't actually have any control over any of them. But I can certainly the ones that I have influence with, well, the one in 168 and the one at Graham Road and Horizons, I will put them in contact with you. Georgie, is that the right place? Or
that's great, and I can point them to the right contact. Yes,
I can certainly raise it for you. As I say, I don't think there's anything. There's no specific reason for that. I think it's clearly just something that's got overlooked or fallen into, it's just fallen by the wayside. But I can certainly do my best to stir it back up for you. Thank you.
And obviously, they're volunteers and they take what they need from it. So,
Yeah, sure. Yeah. It sounds like an excellent thing.
Thank you. Councillor Parker, and then I think that's probably us done on this, and I'll do that proposal.
Yeah, just a comment, Chair. I've got mixed feelings about this whole issue. On the one hand, I've got extreme sympathy for the people in the centre of town who will find it difficult to access this site, and I've made that quite clear at a previous meeting we had with the CCG and others some weeks ago. On the other hand, I'm quite excited by it, because it seems to me that people in South Ward will have access to a much superior clinical experience than maybe they're getting at the moment, in part that is. So I would welcome that aspect. When Mike was talking earlier, he mentioned the possibility of satellite clinics within the town. Is that something he's got wishful thinking about, or is that something, Colin, which is on the cards?
It's not something that's a firm proposal. We wouldn't have additional money in the budget over and top of the 3.2 million to develop satellite clinics. I think that I took that to mean a broader sort of proposal that we think laterally and carefully about what other mitigations we can put in place. So we're happy to look at all different proposals and how we might mitigate, as I say, some of those issues around access. But I wouldn't say we're in a position where we've got a specific plan or a specific proposal that would that we would be able to put before the HOSP at the moment.
Okay, thank you.
Okay, so to finish on this item then, so I'm going to propose a task and finish group of councillors to look at the accessibility stuff for the mitigations. Can I have a seconder, please? Caught you there, Ros, well done. So Ros will second it. Is there anybody, councillors in this group, who wants to be on that? I will give those not on HOSP opportunity. So Sandra, Ros, Ruth. Cool, I'll email the rest that weren't able to attend today just to double check. Thank you, three. I'll be on that too. Excellent. So thank you all for speaking on that one. So we're going to jump back up to the Healthy Western Impact Monitoring. So just to be really clear to everybody why this is on here. So many of you will know that the review was going to be in April. You can work out the situation we're in. That's just simply not going to be possible, partly because of the election and partly because of the pandemic. So June is when it's going to fall, that review. And I wanted to be clear what the metrics were for that, because it's been a while, I think, since people have seen it. So that's why it's on it. That's why it might feel a bit odd that it's here. So Colin, do you want to briefly speak to it?
I will briefly, thank you, Chair. So members will recall this paper, or a very similar paper, coming to the last HOSP in October of last year, and this was on the basis of some work and communication between the Health Overview and Scrutiny Panel and the CCG about the impact of the Healthy Western decisions that were taken in October of 2019. And this review essentially seeks to look at those changes and monitor the impact across the specifically, I think, around the changes to the acute model of care around emergency surgery, critical care, paediatrics and emergency medicine. Section 3 in the paper sets out the HOSP monitoring requirements and compares them against largely the monitoring framework that we put in the original decision-making business case. And essentially this paper is a bit of housekeeping, I suppose, to ensure that when we come to do the review, we've agreed the terms in relation to the monitoring requirements, and how, where there are things that the HOSP have asked for that aren't within the decision-making business case, you'll see we've made alternative proposals about how we will cover that requirement for the HOSP. So our request, I guess, our recommendation is for agreement of the monitoring framework, acknowledging, of course, the inevitable disruption and delay to the timeline that's been caused by the COVID pandemic in some cases.
Thank you.
Thank you.
Open up for any questions that anybody has. Nope. So one very quick question, Colin. So just want to triple check. So with regards to the metrics, that will allow you to evaluate the success or otherwise of the the A&E model, those changes. So we'll definitely allow that, yeah?
Yes, yes. So you'll see that the issues around the staffing of the emergency department, as well as some key quality metrics, will be included in that. As I say, there are some difficulties there, given the very uneven nature of the demand caused by COVID-19 will skew the data, but we'll ensure that we'll give the suitable sort of caveats to that data when it's presented.
Yeah, that's fine. Okay, so I'm just going to take liberty of proposing that from the floor then. Is anyone going to second that we adopt those metrics and June is the review? Oh, nodding heads, right. Thank you, Councillor Ross-Willis. Anybody against that? Nope. Okay, that's quite clearly going to carry then, isn't it? Okay. So we're on to apologies for the length of this. This is typical of my life, overambitious, underachieving. So the next item is the Adult Substance Misuse Treatment Services. That's going to be led by Matt Lenny. There's kind of a part B to this, which will be done by Health Watch, but we'll start with Matt's first. And then once, Matt, you finish your presentation, I will let councillors comment and question. But if it's on mental health, hold off on that bit, because that'll be picked up in Health Watch's bit, and we'll ask that at that time. So over to you, Matt.
Thank you, Chair. So again, in the spirit of time, I won't go through the detail of the paper. I suppose it's mainly to say that we had a request to give a bit of an update on this area of work. As you know, one of the statutory responsibilities of public health and local authorities is to commission substance misuse services. It's one of our three main areas of commissioning that we have responsibility for, alongside sexual health commissioning and children's public health nursing. So the report gives a bit of an overview of how the service has adapted in the current pandemic, but also about how it's developed a working model of delivery to support the needs of local residents. Important to say that there's been changes in substance misuse services over time in recent years. So some of those have been driven, honestly, by some of the budget reductions that we've had to cope with within the public health service, but also within that spirit, trying to adapt the services in different ways to try and meet the needs of our local population more effectively. And I think it would be important for me to say a thanks to our colleagues in the provider service. We are with you, formerly at Action, in the way in which they have adapted their service offer in lots of different ways and found new ways of reaching people's needs. And I'll maybe invite them to say a few words as well about some of that work. But overall, it's been about trying to address those needs as effectively as we can, and generally performance of services in North Somerset is pretty good when you look at it in terms of comparisons, types of outcomes we're receiving. I'm sure there might be particular questions about areas of practice, and that's fine. We're happy to work our way through those. And so we've got colleagues on the call who can contribute to that discussion. But I think it is one of these areas where, looking forward, it's a significant challenge about how we improve outcomes for people with substance misuse issues. During the pandemic, we've seen the ability of maybe reaching out more into the issue of alcohol dependence and how we can support people in that area more effectively and reach a wider group of our population, as well as the people who are, have other addictions in terms of more complex needs around particular substances. So I think it's, and when we look in terms of the recovery from the pandemic and the ambitions that we're trying to develop within the development of our health and wellbeing strategy, I think this is one of the areas where, in terms of reducing the health inequalities gap between those who have the best health and those who have the greatest challenges, this is one of the population groups that we will need to think carefully about where are the opportunities for us to change our service provision, and not just within this service, but all of the connections that make a difference for the people who are coping with these challenges in their life. So that will pick up things like housing, that will pick up opportunities for education and employment, that will pick up family situations, all of those things. It's about how do we coordinate the different elements of support to try and have the greatest possible effect. And I know that colleagues within the substance misuse service think very holistically in that way about overall needs and try and provide support, and using things like the peer support models, which can be quite powerful in terms of helping somebody through a personal journey and providing a sort of very valid way of showing how things can change for the better. So yeah, I probably won't talk too much more than that, because maybe it's more about the questions that members of HOSP have around the detail. But yeah, a big sort of thanks to those people involved in supporting the service and working hard to try and continue to provide that support through what has been quite a challenging time.
Thank you, Matt. So I'm going to open up to questions on HOSP. Just it's related to mental health. Hold off just in a moment, because it's a presentation from Health Watch. If no one's going to ask a question, I'll take the liberty of doing the first one. So obviously we know pandemics impacted the service, and I think there's some positive developments I've seen around web chat. Are we kind of thinking long term if that's something that could be integrated into it? And then a second question is, the average length of time for non-opiate users in North Somerset is double compared to nationally. Do we know what's driving that?
Yeah, so I think what I'll do is I'll see if so we've got Jo on the call from We Are With You, whether she wanted to pick up something about in terms of the changing model of service delivery and what that might look like in the future. So if you're happy to do that, because I think it's just probably better to hear from somebody who's directly involved in terms of that adaptation rather than me talking in a slightly more theoretical way.
Yeah, that's fine.
Hi, afternoon everybody. Thanks for inviting me along to this. So I'll just mention about the non-opiate clients in terms of the successful completions. I mean, we've been driving our way forward and have made great strides in the opiates and alcohol successful completions, and we're on the right journey for the non-opiates. I think the biggest issue that we've had is a lot of our non-opiate clients who maybe use cannabis and alcohol are suffer with mental health. And this does have an impact on their mental health problems. And there haven't been any other services available through this pandemic for these people. So it hasn't felt right to be closing people who haven't got any support anywhere else. And they may not be ready yet to be closed. So hopefully, as things are starting to hopefully open up and other services will be available for our service users, that will change. But we're continuing to be working forward, and we've done a lot of work within our teams to be able to make this happen and close people successfully through this period of time. We've made a lot of changes around our services during this period, as you've probably read, and we've continued to stay open throughout, particularly for those high-risk people who are homeless and who don't have any facilities in order to be able to be with us via Google Meet or telephone, which is most of the appointments we've been doing. And we have had a lot of success in the way that we have been able to still offer the services to clients through group work. Very quickly, we adapted all of our staff out to working from home and having a skeleton staff in the office and providing groups for people, all different. I think we've got 6 or 7 groups a week that happen, and they are full most of the time. So it's showing that you know, technology is great, and we're able to be there for people and continue to do that. But there are people who still, that's not good enough, and we still need to be able to see people face to face. There are a lot of people with a lot of risks, whether it be physical or mental health, and we will continue to be seeing those people face to face for as long as we need to, and hopefully we'll be able to continue to offer people the services that they need.
Perfect, thank you. Anything you wish to add on top, Matt?
No, I don't think so. I think Jill's described that really well, and you know, again, credit to the adaptations that have taken place. But it is about getting this balance right, isn't it? Different mechanisms of service delivery for different groups of people. We need to keep an eye on making sure that we're not leaving anybody behind in that mix of service provision.
Councillor Mike Bale noted your hand.
Yeah, thanks, Kieran. I just wanted, I mean, firstly to say, just to echo Matt's comments about the quality of the service that's been provided by We Are With You and the team over this past year. I mean, they've always provided a really good quality service for North Somerset, but I think it's been particularly impressive to see the reach and impact despite the challenges of the pandemic. And I think, you know, when we read the report, the thing that comes across quite clearly is that the fundamental problem is that we don't spend enough money on our support services for tackling alcohol and drug misuse, and we are seeing a steady increase in demand and need, but unfortunately the reality is that the budgets available have been reduced, and we've seen that over time in terms of public health more broadly. So, you know, that's the fundamental difficulty, and I think what we do need to do is more strongly articulate the need for investment in public health services. And I know that's something that Matt, through the directors of public health networks, and certainly I at a political level have been banging the drum about for some time. But just one sort of question I wanted to pitch to our NHS colleagues who are still on the call, and that is that there are clearly enormous benefits to the health and social care system from getting substance misuse services right. You know, when I think about rough sleepers and homelessness, when I look at hospital admissions, when I look at long-term care needs, getting mental health support and interventions right for those experiencing substance misuse challenges is at the heart of some of the most complex cases that we have. So we do need to do more to join up our work and to invest in those services as a priority. So I think my question would be to officers and to NHS colleagues, what are we going to do to really push that?
Does anyone respond to
that? Don't all answer at once.
Sorry, just wrestling with the mute button there, actually. So I absolutely agree with your analysis of the issue, Councillor Bell. And, you know, we are investing more money in mental health services. For example, the Safe Haven Centre that's in the centre of Weston, which is there to serve people with the sort of concomitant mental health issues that often, not always, but often go hand in hand with substance misuse. And I know that Ted in the team, the council team, has been looking at some additional resources that we could work on in terms of preventing drug-related deaths, for example. So we are in constant contact, and of course we can always do more, but very happy to progress those conversations offline if there are other initiatives that we could look at to try and improve the way that we join up services for this important client group.
Thank you. So Ted, obviously you've raised your hand to comment on that, so I'll let you come in on that, and then after that we'll go to Vicky from Healthwatch to talk about their access to mental health support report, which actually fits into all of this because they looked at this service. Oh, Ted, you put your hand down, so I'm assuming that's done.
No, it's up again.
Oh, it's up again. All right.
I was being too quick to read now. So thanks, Chair. I don't know if everyone knows, I'm the commissioner for drug and alcohol services. So I commissioned the We Are With You service. I also wrote the report. Just picking up on your comment, Chair, about the use of web chat and remote services. I think that has been really effective throughout the pandemic. It's been a bit of a kind of enforced natural experiment that we've had to kind of adapt to, and it has proved to be really good. But what it has shown, I think, is that it's a different client group that engages through there. So I think as we go forward, I think, and Matt picked this up, that will be in addition to what we've already been delivering in the past. So for some people it works, for others I think the face-to-face therapeutic interventions are kind of essential, and it will be there's a bit of a wait and see how people are going to be, what level of illness people are going to present with when they're able to come back into the service properly, having had this long time without their face-to-face engagement. In relation to the long-term or the long time scales that we have non-opiate users in treatment, as Jill picked up, we are looking at how we can make sure that our treatment outcomes for that client group are good and are better. For me, I don't think that that's necessarily an issue, that they're in treatment for a longer period of time. That cohort of non-opiate users captures a whole range of different people, from cannabis users to crack users to Valium, benzo users. So it is quite a broad group, and within that there will be individuals that need to be in treatment for quite a long time. So as long as they're getting the treatment that they need, they're getting positive outcomes, they are staying safe and well, then I personally don't think that that's a huge issue, but it's certainly something we are looking at. And in response to Mike Bell's point about holistic care and doing more for a client group that is unarguably very vulnerable and has very complex needs. I had an interesting conversation yesterday. There is some funding coming out from central government for new drug treatment services, and I had a conversation with the local pharmaceutical committee, so the LPC, Richard Brown, about the potential of developing one of the pharmacies in Weston to become a sort of holistic, super substance misuse focused pharmacy that would look at delivering kind of a whole package of health and well-being care for people who are using the needle exchange already within that service. So a lot of our injecting drug users use our pharmacy needle exchange. So bringing more sort of healthcare alongside that. If we can get that off the ground, I think that would be a really great little project that we can then bolt stuff onto, mental health care, sexual health stuff. So we are looking at the delivering more to this client group.
Excellent, thank you. That's good to hear. So we're just going to move to Vicky Marriott from Healthwatch, who's going to talk to us about a report they did into accessing mental health support on this service, actually. So Vicky, would you like to take us through that?
Yeah, thank you, Councillor Connolly. Oh, thank you. I was going to ask if whether you did those available. just want to say thank you to the chair and to the committee for inviting us to bring this report to you, which is clearly a timely report. We at Healthwatch North Somerset, we use public feedback to decide on our priorities each year. So in 2019, mental health was a service that we had feedback on predominantly, and therefore in 2020 we decided that would be one of our key project areas. And amongst those in North Somerset who struggle with their mental health are those with co-occurring substance misuse problems. So we also decided when we had a new contract for Healthwatch in 2019 that we would predominantly make sure that our projects are co-produced with service users, so so that we are really looking to hear from the least, listen to service users to help shape projects and hopefully sort of have impacts on services that where the gaps are in services. So I'm reporting on a project that was done by my colleague Chile Yoris, and that was completed just at the end of last year, very end of last year. So thank you. I was going to mention the incidence in North Somerset. There is a high incidence of adults with alcohol, opiate or crack dependence. You've seen this in the report. I'll go through it very quickly. In 2016-17 and 17-18, there was almost 3,000 people with a substance misuse problem. And in 18-19 and 19-20, nearly 14,000 people receiving support from AdAction, which then became We Are With You. And I see Jill's with us on this today. So they were commissioned to deliver specialist drug and alcohol interventions and support services. This includes one-to-one and social group psychosocial therapies, physical and mental health support, and they have a part-time psychologist. They tend to support clients with lower level mental health issues, but they have reported to us in this project that they're increasingly seeing clients, and as you've just heard, with more complex to severe mental health issues. So the co-production, as you can see, was with We Are With You. I'm hoping that we'll get to the correct slide in a minute. I won't be a minute. And this is just a bit of background. And we had a steering group. I think I'm slightly behind the slides, but we had a steering group which really was involved from the beginning.
Sorry, we'll get you to the right slide. It's the second slide, I think.
Do you want me to tell? Can you tell me which slide you want me to?
Sorry, I'm probably right at the beginning, Leo.
Right at the very beginning.
Yeah, sorry, slightly slower than. Thank you. I'll go through well, actually, sorry, the second one.
Yeah, fine. I'm with you now. Sorry, I was.
Thank you. Sorry, the third one. Actually, I've just got onto the third one. Thank you. So the steering group had service users in it, and that was from right at the beginning. This happened in between our lockdown waves 1 and 2. So we were actually then also able to meet some people, say, face to face, and the survey that they helped create was completed face to face with some groups and on phone calls with others. And then the steering group again looked at the findings and the report. So the overall aim was to explore the service user experiences, obviously, of the access and the support, and then to identify the range of needs that service users identified in their feedback, and then obviously look at the examples of good practice. Thank you, Leah. I could have the next slide, thanks. As you can see, it wasn't an enormous cohort, but it was fantastic to be able to access, 30 people who had these experiences and could tell us about them. 86% were in recovery, and obviously, say 60% for 3 months or more, and 80% of those was considered to have a mental health condition, some for quite some time, and they responded and told us, and as you can see from the slides, since childhood was at least 6 of them, and many had them for considerable years. 23 did say they were engaged with mental health teams in North Somerset. And can I have the next slide, Leo? Thank you. For many, as you can see, the only support was through their GP or from We Are With You. And the positive experiences were low, unfortunately only 20%. And the main complaints were that the GPs didn't listen to concerns, or there was a considerable length of time waiting to see a GP, or there were access issues with seeing a professional at all. Most of them indicated that they didn't have their mental health problems diagnosed or assessed because of their addiction. So they felt discriminated against. And you can see that quote there. Next slide, please, Leah. One of the issues that came up was really the need that some participants were given or suggested to that they were required to achieve abstinence before mental health treatment could be provided. 36% said they had not received any support for their mental health problems, and 63% said it was difficult or very difficult to access any mental health services at all. And there we have the relapse rate from the recovery. 76% relapsed. When asked about triggers, they felt it was due to either unresolved mental health issues or the kind of wider determinants of their experience, which included housing instability, and also triggers such as that they considered were a difficult environment for them, like the centre of town in Weston. Employment support was also cited, as you can see below, and support for their mental health. Thank you. So we were looking at obviously what We Are With You were providing, and wanted really to see those become more available, and for the support, particularly for the more severe mental health, to be extended, those with more mental health that was severe, and also to focus on, as was said earlier, really around holistic needs of these service users. And also there was a real recognition that trauma-informed treatment should be a stronger part of the support because of the large numbers of people with adverse childhood experiences in this cohort. And lastly, it is really about being non-judgmental. Sorry, that was just the last bit, and of a more personally created service for the individual. Thank you. So these are the 6 recommendations we made. It was really around implementing a dual diagnosis strategy because of the inequity that we felt was faced by these people with the concurrent mental health and substance misuse problems. So an increase in funding to expand the provision of the North Somerset substance misuse and mental health treatment, and also really to offer a more non-judgmental service, integrate services better, strengthen skills around ACEs and longer term mental health conditions, and ensure the training around discrimination and stigma. So if Chair is happy for me to take questions, I'm happy to do that.
If any council had questions about mental health, whether it was in Matt's report or this report, this would be the time to ask it now.
Thank you.
So that's fine. So just on the recommendations, and Matt, I've noted in your report that you've got trying to incorporate, I think it's mental health assessments you said, into the service a bit better.
Yeah.
What are your thoughts, Matt, about the timeline for that, and how possible that is, and all that?
So I think in terms of the service itself, thank you for presenting that report. It was a really helpful piece of research, and it was good to see the lived experience of people using the service being represented in that way. So thank you for that. I think what it was identifying there is in terms of We Are With You, you've got a service there which is doing a good job in meeting people's needs and is trusted. So it's how we connect that service more effectively to mainstream, if you like, mental health support, and how you can find a pathway through for individuals who are presenting with substance misuse needs into mainstream services. And so I think this is something where we would want to work with our colleagues in CCG, but also primarily in primary care, where a lot of people will have their needs met, but also the specialist mental health provider. We need to look at this in terms of how do we take those barriers down and allow for those holistic needs to be thought about holistically, rather than seeing somebody as a series of conditions, because that's not what human beings are they? They're complex beings with needs in different parts of their life, and you tend to only improve outcomes in one area when you also address the others. So I guess it's probably a good sort of prompt for us now to think about, on the back of the report and the welcome interest from HOSP, what we could take away to then do some initial conversations around that, and then maybe come up with a bit of a timeline for what an improvement plan might look like from the point of view of the service user. What would be a better experience, and how could we try and fill that gap? So maybe that's something initially, and that myself and Colin and others could take away, do a bit of work on, and then bring back to HOSP with some indications of how we'll try and make those improvements last for service users.
Sounds sensible to me. Colin, if you're happy with that as well from the CCG, yeah, that's a nod. Okay, in that case, that's fine. I mean, there are recommendations in the report, but actually I don't think they need to be voted on, because you've in effect said you're coming back to us anyway, so we'll just bring you back when we're at that space. So I think that's fine. So that brings us to the final, he says in inverted brackets, no, in the vice chair bit still there, health and wellbeing strategy. Georgie MacArthur, you're down for presenting this. I'm mindful, obviously, we've got a all-member briefing at some point in April, and I'm also mindful of time. So if you're able to articulate it in slightly shorter space and perhaps you're envisaging, that would be useful. Thank you.
Thank you, Chair. Yes, I'll try to be as quick as possible. I just have a few slides to summarise the paper that was brought to the group, which essentially just provides a quick briefing about the process and structure of developing the health and wellbeing strategy, which is currently underway. And yeah, as you mentioned, we'll be coming back for a sort of fuller briefing and discussion in April. I'm just going to share my slides and hope you can see that.
Yeah, we can see it.
Brilliant. So this is really just an introduction, but to summarise, the Health and Wellbeing Board has a statutory duty to develop a joint health and wellbeing strategy that has to outline how it will meet the needs of the local population. And this has to be taken account when the relevant organisations are preparing and revising commissioning plans. And development of the new health and wellbeing strategy was endorsed by the Health and Wellbeing Board first in September, but then with the new approach and timeline in February 2021. And this strategy will really provide a very timely and important way of really outlining exactly what actions we can take to improve health and wellbeing, which is particularly important given the last year and the current context. Essentially, the strategy will outline key ambitions for improving health and wellbeing. How are we going to do this and reduce health inequalities? Those key themes that capture exactly what actions we'll take in which areas. Importantly, a very focused action plan. So how we meet those ambitions, who owns the action, how we'll measure success and what timeline we'll use, and how we'll work with residents, communities, organisations across the system to achieve this goal. So taking that collaborative approach and accounting for all the other work going on at the moment. And also ensuring that addressing health inequalities is a central ambition alongside how we'll improve health across the patch. This slide just highlights how there's a very clear awareness of the range of different strategies already in place across the council and with partners through integrated locality groups, Healthier Together across the council. And these will be taken into account and links made with those as far as possible where relevant. And of course, the sort of national policy context, things like the NHS long-term plan and place-based approach to reducing inequality settings, and think about particular settings such as schools or workplaces, and ensuring that all of these are captured in the work. There are 4 key strands at the moment, so consultation and engagement with residents, stakeholders and others to ensure that we're capturing views about what matters most to people. Bringing together quantitative data, so what we know about health need and inequality in North Somerset, evidence for the most effective interventions, how can we ensure that we're bringing into place things that will work best, and mapping across the system. So as I just mentioned, thinking about all the stakeholders, existing strategies and programmes that need to be taken into account. And all of those strands will come together to develop those themes and priorities for action. This slide just really highlights the sort of framework for thinking about the structure in a sense. So those leading causes of early mortality that we know are in place in North Somerset, leading causes of illness and morbidity, long-term ill health, and then thinking back to sort of access to and delivery of health and wellbeing services, behavioural risk factors and other influences on health, and then upstream, or sort of more broadly, those wider determinants of health, transport, education, housing, etc. And then for all of that, thinking about early intervention and prevention in the early years, so the best start in life for children and young people, how best to ensure that people live well through those working age years, and then ageing well as well. And similarly across that sort of framework, thinking about the different parameters, I suppose, of health inequality, so captured in those circles at the top, making sure that alongside all of those we're thinking about health inequality and how best to address that. The work is being overseen by the steering group here, which I've just listed here to highlight these individuals. I'm very grateful for all the input and oversight that the group is providing, and that this includes representation from across the council and the CCG, integrated locality groups, and the Wellbeing Collective Board. Just quickly to highlight the consultation engagement process, this has taken place mostly through February. There's a few more activities to be done in March, but so far we've had an e-consult survey for residents and stakeholders, a tailored survey for businesses. We held workshops for the members of the public and stakeholders. We've engaged with integrated locality groups and held workshops for town and parish councils representing north, south and central parts of North Somerset. We've met with various networks and forums involved in health and some of the delivery of what will be in the action plan, groups across North Somerset Council, including officers, yourselves, corporate leadership team and the executive, and use a range of different communication channels to ensure we can try and get as broad a reach as possible. And some of this work is ongoing to ensure that we can reach the most hard to reach groups and health inclusion groups. I've just added here the sort of timeline to add perspective to this. So at the moment, we're in the process of analysing all of the data and bringing that together, sort of qualitative and quantitative data, evidence of what works best, and synthesising those themes and starting to really put together the sort of structure of the action plan so that we can shape that and get buy-in and agreement from different partners, then look towards finalising development and the strategy in May and June and publishing it in July of this year. So really this was just for discussion and comment, so very glad to hear views on the proposed approach, the narrative of the strategy, thoughts and perspectives around themes, priorities, different interventions to be considered and included, and any comments around the consultation and engagement so far. And I've just added our email address for the work, and thank you. I'll just close this now. So yes, thank you very much.
Thank you. Councillor Ros Willis, you've got a question.
Yes, thank you, Chairman. So the date for this is July 21, which isn't that far away. And I'm just wondering if there's an opportunity to extend that a little. I know this is a long strategy, you know, in length of time, but I think because of the last year we've gone through and what we're still doing now, which we are coming out of things, but people's priorities and needs, I think, will have changed. And I think what we once thought was an inequality that needed sorting out is a different inequality now, or there is a different need. People have been home isolated. So whereas someone was out busy, you know, someone who's on their own at home was out busy in the community and doing things, they've been isolated and not seen a soul. apart from on one of these stupid Zoom things or whatever we're on, you know, or talking to the dog or a neighbour over a fence. You know, we've lost a lot of things in our social isolation. And I'm just wondering if we could take this opportunity just to pause it for maybe even perhaps till September, just to give us a chance to really hear those differences and those nuances that we all know about, because we're focusing on what we've learned over the last strategy and what we had in place, and we know some of the stuff we need, but I just think there's stuff that some of us haven't even encountered or thought about that someone is having at the moment. And I'm just wondering if we could have an extension of that consultation to speak.
Thank you for that comment, and I think it's really important, the point about ensuring that we absolutely capture the impact of the pandemic and how behaviours and inequalities may have changed. It's interesting that actually so far in our consultation we've very much captured, I think, already some of the impacts of the pandemic. So people have talked a lot about mental health, social isolation, digital inclusion, access to green space and physical activity, which I think is very reflective of the sort of lives we're leading at the moment, and, you know, impacts on poverty and crisis and inequalities, as well as some of the longer term impacts of COVID in relation to long term conditions or behaviours and how COVID will affect things going forward. So it's interesting that I think we are capturing some of that already, and that's very much being taken into account in terms of developing the themes. And we still have a few months to make sure we're gathering all of the information we need from different groups and bringing that into the sort of shaping of the strategy. And I think to a certain extent, I think some of the issues were present before the pandemic, but perhaps have been brought into sharper focus. So that is being captured at the moment. But I understand the point about sort of wanting to make sure we're being very thorough about that and considering the impacts. But it's quite interesting that the themes we're getting now seem to reflect the impact of the pandemic, but actually also chime with some of the work that was done prior to the pandemic from the place-based approach to inequalities, where mental health, physical activity and inequalities were key themes as well. So I think perhaps they're sort of being exacerbated, but are similar. I don't know if Matt, you wanted to add something.
Yeah, if I could actually. So no, you raised a really important point, and I suppose it's good to emphasise the fact that this isn't the kind of we've done a strategy, now we've closed the door. It would very much be about setting up different ways of working from now on. So how are we more collaborative? How do we think more in terms of community and the opportunity to work with and for communities, as opposed to seeing it as a strategy that's run by statutory agencies? I think some of the themes we're getting through are really important in that area, about where the potential is to make a difference. So and this principle of engagement and listening is going to be something that we'll be picking up as part of the overall strategy action plan as well. So how do we keep checking in to make sure that we're still concentrating on the right things? And if there are either new challenges or maybe even new opportunities to do things better, how do we incorporate that into our way of working? So I don't know if that helps give you some assurance that it's almost opened up a form of listening, and the listening will continue, rather than it being we're just set on one task of producing something and then seeing that as a job done. I think this is really symbolic of hopefully a way of working that will carry us into the future, because ultimately it's showing us the only way we're really going to improve people's health and well-being and the quality of their lives is to have that approach. We can't see it as a remote thing. We have to see it as an active collaboration. So that should continue for many, many months to come, I would say.
Councillor Willis, do you want to come back in?
Yeah, thank you, Kieran. So you see, I'm asking for that little delay. I know this is a living document. We've done them, and we do have living documents that change. We have our vision that's there and where we want to get to. But, you know, we haven't come out of this social isolation yet. People's anxiety, I'm very mindful that people haven't come back out into society yet. We don't know what's going to hit mental health when you come out of anxiety. First time I went out of the first lockdown, I sat in my car at Waitrose, got out, got in the car, drove home and burst into tears. I couldn't go into Waitrose shopping, and I'm supposed to be strong and leading the flipping community, and I couldn't get out of the car. You know, people have been locked up a very long time, and the anxiety levels, you know, when you get out and you've got more than 10 people, and you haven't got the cat and the dog looking at you, or your husband or your wife or your partner, suddenly you've got all these people. We don't know what's going to hit. And I'm just asking that we just take a little bit more time. We know what we're doing, but I think we still need to be a little bit softer on that July bit. Let's give it a couple of months to make sure, you know, we're hoping to come out in June properly, but who knows? But if we do, who knows what's going to happen? And I think once people get back to normal, ordinary life, I don't think we'll ever be normal, to a bit of ordinary life, I think it's going to hit everybody differently. You know, I'm sat in the town hall like the Mary Celeste at the moment. If I open the door and see somebody, I think I'll pass out because I'm not used to seeing people, you know. So I'm just asking we just think about it.
So we can take that back in if that's helpful. I mean, I suppose one of the things that we have is a challenge is this has been sponsored by the Health and Wellbeing Board, who've asked us to go away and do a piece of work, and we had to delay the publication because of the pandemic and delay. So it's one of those difficult challenges, but we're going to be having another workshop probably in June to talk through some of the feedback and some of the issues before we publish. So we can put that into the discussions and then try and make a reasoned judgment with the Health and Wellbeing Board, if that's okay. Thank you.
Councillor Caroline Cherry.
Thank you very much. I absolutely agree with Ros Willis. I believe that because of COVID, far too many people feel that they haven't been able to express their views or have their voices heard. They are shielding the very people that need to be consulted are, out of touch because they're not necessarily online. And they've all told me, and this has happened specifically in my own ward, they've got very upset that they are not being consulted, that there aren't public meetings, that decisions are being made without them being talked to. And we really have to get this right. So we need to be democratic. And if we have to extend the period, we have to do it, because otherwise we won't be listening to the voices that need to be heard. So I totally agree with Ros on this. Thank you.
Okay, so I think, Matt, George, you said you'll take away and consider that. So is there any other questions? No. So I'm going to close the meeting in 30 seconds. Councillor Caroline Cherry, at the start of the meeting, we asked for a vice chair. Someone nominated you. You didn't say if you wanted it or not. So this is your time to say yes or no. Okay. So is there anybody else? So okay, anybody else before we jump in with Caroline for a vote?
Or Ros.
No, we've tried Ros. We've tried Ros. Yeah, we've tried that. Okay. In that case, can I have a proposer and a seconder? Right. That's almost all of you. Okay. And anybody against? No.
Thank you.
So we'll take that as passed.
Thanks.
Thank you to everybody for attending today. Thank you for the listening and going the whole way through this. I appreciate it was longer than perhaps I envisaged. So keep safe and we'll see you again.